Straightening the knee is the order of the knee: flexion, extension, abduction, adduction. The correct answer is B. Extension. Turning the palm so that the radius rotates over the ulna is pronation, supination, rotation, elevation. The correct answer is A. Pronation. An abnormal mediolateral curvature of the vertebral column is called scoliosis, kyphosis, lordosis, rotation. The correct answer is A. Scoliosis. The cerebrospinal fluid flows in the space between arachnoid matter and pyometer, durameter, ligamentum flavum, periosteum. The correct answer is A. Pyometer. The central nervous system consists of the brainstem and the cerebellum, spinal nerves only, cerebrum and the spinal column, brain and spinal cord. The correct answer is D. Brain and spinal cord, which is not a function of the cerebrospinal fluid. It increases pressure at the base of the brain. It fills the subarachnoid space. It cushions the brain. It protects the central nervous system. The correct answer is A. It increases pressure at the base of the brain. Heart rate is influenced by the cardiac center in the thalamus, medulla oblongata, cerebellum, cerebral cortex. The correct answer is B. Medulla oblongata. The concentration of sodium is lowest in which compartment? Intracellular fluid, extracellular fluid, lymph, blood. The correct answer is A. Intracellular fluid. The middle layer of the bladder is called the tunica serosa, tunica muscularis, tunica mucosa, tunica adventitia. The correct answer is B. Tunica muscularis. Urine is 90% water and 10% solute, 96% water and 4% solutes, 99% water and 1% solutes, 80% water and 20% solutes. The correct answer is B. 96% water and 4% solutes. The removal of water and solutes from the filtrate in the renal tubule is via extraction, filtration, secretion, and reabsorption. Answer is reabsorption. The small holes in which some connective tissue cells reside are termed as lacunae, lamellae, lumen, lamage. The correct answer is A. Lacunae. Small hair-like structures on the surface of some epithelial cells are termed as villi, diverticula, cilia, microvilli. The correct answer is C. Cilia. The coronary veins drains the deoxygenated blood from the heart into the left atrium, right atrium, superior vena cava, inferior vena cava. Correct answer is B. Right atrium. Which of the following is the most characteristic feature of acute inflammation? Vasodilation and increased vascularity permeability, margination of leukocyte, vasoconstriction, vascular stasis. Correct answer is A. Vasodilation and increased vascular permeability. Which brain lobe, if injured, results in memory loss and impaired hearing? Frontal, occipital, temporal, parietal. Correct answer is C. Temporal. Stimulation of the sympathetic nervous system produces bradycardia, tachycardia, hypotension, decreased myocardial contractility. Correct answer is B. Tachycardia. The component of blood that triggers defense and immune responses is the RBC, platelet, WBC, hemoglobin. The correct answer is D. Hemoglobin. What does the thymus do? Protects the body against ingested pathogens, stores blood cells until they mature, is a reservoir for blood, removes bacteria and toxins from the circulatory system. The correct answer is B. Stores blood cells until they mature. The left ureter is slightly longer than the right because the right kidney is higher than the left. Left kidney performs more functions. Left kidney is higher than the right. Left ureter has a 3-layered wall. The correct answer is C. Left kidney is higher than the right. A nurse is caring for a client with depression who has not responded to antidepressant medication. The nurse anticipates that what treatment procedure may be prescribed: neuroleptic medication, short-term seclusion, psychosurgery, electric convulsive therapy. The correct answer is D. Electroconvulsive therapy. In following which is not a disturbance of consciousness: stupor, hallucination, confusion, coma? Correct answer is B. Hallucination. A person being a rope take to be a snake. This condition is called delirium, derealization, illusion, hallucination. The correct answer is C. Illusion. Abnormal sensitivity to light is known as photophobia, hydrophobia, aphasia, diplopia. The correct answer is A. Photophobia. When a client makes up stories to fill in the blank space or memory, it is known as rationalizing, confabulating, lying, denying. The correct answer is B. Confabulating. The most common type of dementia is Alzheimer's disease, Pick's disease, Parkinson's disease, Tick's disease. The correct answer is A. Alzheimer's disease. The first drug of choice for a patient admitted with status epilepticus is diazepam, phenytoin, sodium valproate, carbamazepine. The correct answer is A. Diazepam. A patient keeps repeating the last few words of what he heard. The condition is known as third echopraxia, echolalia, neologism. The correct answer is echolalia. In following which therapy is used for treating phobia: hypnosis, aversion therapy, ECT, systematic desensitization? The correct answer is D. Systematic desensitization. In following which is not an example of opioid: morphine, pethidine, naloxone, heroin? The correct answer is C. Naloxone. In following which is the major indication of ECD: severe mania, phobia, severe depression with suicidal thoughts, hysteria? The correct answer is C. Severe depression with suicidal thoughts. Impiramine is an anti-anxiety drug, anti-manic drug, antipsychotic drug, antidepressant drug. The correct answer is D. Antidepressant drug. Lithium is tranquilizer drug, anti-maniac drug, antidepressant drug, anti-Parkinson drug. The correct answer is tranquilizer drug A. A patient with OCD frequently washes his hand. What is the reason behind this? He protects himself from infection. He protects himself from dirt. It is the part of treatment suggested by psychiatrists. Hand washing relieves anxiety. The correct answer is D. Hand washing relieves anxiety. Which atypical antipsychotic medication has the most potential for a client to experience sedation, weight gain, and hypersalivation? Haloperidol, chlorpromazine, risperidone, clozapine? The correct answer is D. Clozapine. A client is admitted to the emergency department after a car accident but does not remember anything about it. The client is using which defense mechanism? Undoing, rationalization, suppression, repression? The correct answer is D. Repression. Which of the following ways might hallucinations be experienced in schizophrenia? Auditory, olfactory, gustatory, all of the above? The correct answer is D. All of the above. Children with ADHD are known to have deficit in which of the following brain areas: perception, motor functioning, executive functioning, memory. The correct answer is C, executive functioning. Spinal anesthesia is given between L3, L4, L2, L4, L6, L7, L2, L3. The correct answer is A, L3, L4. Which assessment should be made by nurse in first 24 hours of burn? Hourly BP, skin color, pain assessment, hourly urine output. The correct answer is D, hourly urine output. Diabetes insipidus is due to deficiency of insulin, antidiuretic hormone, glucose, oxytocin. The correct answer is B, antidiuretic hormone. Absence of bowel sound and distended abdomen after surgery indicates bleeding, perforation, paralytic ileus, constipation. The correct answer is C, paralytic ileus. Neck rigidity, fever and headache are classical signs of meningitis, increased ICP, hypervolemia, Parkinson's disease. The correct answer is A, meningitis. During administration of mannitol, nurse should monitor vital signs, weight gain, level of alertness, urine output hourly. The correct answer is D, urine output hourly. Pacemaker is used in some patients to serve the function that is normally performed by the AV node, SA node, bundle of his septum. The correct answer is B, SA node. When ventricular fibrillation occurs in the patient, the person reaching the patient should first administer oxygen, defibrillate the client, initiate CPR, administer IV soda bicarbonate. The correct answer is B, defibrillate the client. Drug used to treat hyperkalemia: atropine, insulin, digoxin, furosemide. The correct answer is B, insulin. DOTS program introduced for the treatment of malaria, leprosy, polio, tuberculosis. The correct answer is D, tuberculosis. The immunoglobulin related to hypersensitivity and anaphylaxis: IgA, IgG, IgE, IgM. The correct answer is C, IgE. The best position for examining the rectum is prone, seams, knee, chest, lithotomy. The correct answer is C, knee, chest. An agent that kills microorganisms is antiseptic, bacteriostatic, bactericidal, Dettol. The correct answer is C, bactericidal. Cardiac troponin level helps in diagnosis of myocardial infarction, congestive cardiac failure, ventricular tachycardia, atrial fibrillation. The correct answer is A, myocardial infarction. Spinal bifida occurs due to accumulation of blood in the brain, neural tube defect, myometrium is affected, defect of pericranium. The correct answer is B, neural tube defect. Toilet training should be started for a baby at the age of infant, toddler, preschool, school age. The correct answer is B, toddler. Mode of transmission of hepatitis A is fecal-oral route, blood products, sexual contact, skin contact. The correct answer is A, fecal-oral route. Increase in the number of new cases of a particular disease in a community leads to increased prevalence rate, increased incidence rate, mortality rate, acute mortality rate. The correct answer is B, increased incidence rate. The administration of ready-made antibiotics is called as natural active immunity, natural passive immunity, artificial active immunity, artificial passive immunity. The correct answer is D, artificial passive immunity. In administration, principle of division of work is essential because workers do not like interference. It provides job satisfaction. Administrator cannot do all the work by himself. It prevents overlapping of work. The correct answer is D. It prevents overlapping of work. A situation where a supervisor gives some of her work to her subordinate is known as decentralization, delegation, responsibility, authority. The answer is D. Authority. Pulse pressure is diastolic pressure, systolic pressure. Difference between systolic and diastolic pressure. Pressure in pulmonary veins. The correct answer is C. Difference between systolic and diastolic pressure. Removal of gallbladder in person could lead to impairment of fat digestion, impairment of digestion of protein, jaundice, increased acidity in intestine. Correct answer is A. Impairment of fat digestion. Edema is due to increased permeability of capillary walls, reduced return of lymph, increased capillary pressure, all of the above. The correct answer is A. Increased permeability of capillary walls. You are caring for a client who has just returned from surgery and has received intravenous morphine minutes before leaving the recovery room. You need to assess the client's pain now and again at which of the following times: in 20 to 30 minutes, in 1 hour, in 2 hours, in 3 to 4 hours. Correct answer is A. In 20 to 30 minutes. Where is ribosomal RNA used in protein synthesis? Produce organelles, mitochondria, Golgi apparatus, centrioles. The correct answer is D. Centrioles. यस्तै भिडियोको लागि मेरो च्यानल सब्स्क्राइब गरिदिनु होला। त्यसै गरी यो भिडियोलाई लाइक एन्ड शेयर गर्न नभुल्नु होला। धन्यवाद।